The brain plays a very important role in the pathophysiology of type 2 diabetes, but in a somewhat different way. When we eat a meal, there are a number of anorectic molecules which are secreted that tell us to stop eating. Now, one of the very important ones is GLP-1, which we talked about earlier. So GLP-1 is not only important for telling your beta cells to secrete insulin, but it also sends a signal to the hypothalamus, the appetite regulating areas, to stop eating. And what we have come to learn now is that your brain has become resistant to GLP-1. This makes you overeat. And as you overeat and you become obese, you become insulin resistant. And this makes the insulin resistance much worse. So this is a study that Dr. Matsuda and I carried out many years ago using BOLD MRI, focusing on the hypothalamic area, as you can see here by the blue box. And then we gave these individuals who are obese, these are not diabetics, these are obese individuals with normal glucose tolerance. We gave them an oral glucose tolerance test. They got a very robust increase in insulin. And then we looked at the signal that was generated in the posterior hypothalamus. And you can see in orange that the BOLD signal was markedly decreased, meaning there's decreased activation of these neurons that are involved in the appetite regulation. And then in the bottom panel, you can see it also takes longer for this signal to be appreciated. So this is reflecting the resistance to GLP-1 in other anorectic molecules at the level of the hypothalamus, which is predisposing to the development of obesity, which of course is a disaster for our type 2 diabetic patients.